Have you ever wondered about the effects of ashwagandha on females? As ashwagandha's popularity soars in the wellness community, it's crucial to understand its roots and traditional uses. Originating from the rich soils of India and North Africa, this powerful herb is praised for its potential health benefits. Yet, like anything else we consume, it's essential to be aware of its possible side effects. Not all bodies respond the same way, and females in particular may experience unique reactions. Let's delve deeper into the side effects of ashwagandha for females. Despite its numerous health benefits, ashwagandha does have potential side effects that you should be aware of. This ancient herb, revered for its adaptogenic properties, can sometimes cause discomfort if not used properly, or if taken in excess. The first and most common side effect is gastrointestinal distress, which can include symptoms like nausea, diarrhea, and stomach upset. Another potential side effect is sleepiness or drowsiness, especially when taken in large doses. Additionally, ashwagandha might lower blood sugar levels, which could be a concern for people with diabetes or low blood sugar. For those with autoimmune diseases, ashwagandha might cause the immune system to become more active, potentially exacerbating symptoms. Lastly, there have been reports of allergic reactions, though these are relatively rare. It's important to remember that everyone's body responds differently to supplements, and what may be a side effect for one person might not be for another. Now that we've outlined the side effects, let's examine each one more closely. The first side effect we're looking at is hormonal imbalance. Ashwagandha, a popular adaptogen, can interact with the hormonal balance in your body. This can lead to fluctuations in thyroid hormones, which can result in symptoms like fatigue, weight gain, or mood swings. It's important to note that while ashwagandha is often used to help manage stress and anxiety, the hormonal changes it can cause might not be suitable for everyone. Next, let's talk about gastrointestinal issues. Some people may experience stomach upsets or diarrhea when taking ashwagandha. This is because the herb stimulates the digestive system, which can disturb some people's stomachs, especially when taken in large doses or on an empty stomach. Another side effect that we need to discuss is sleepiness. Ashwagandha has calming properties that help to reduce anxiety and promote sleep. However, for some, this calming effect can translate into excessive drowsiness or sedation, especially when first starting to take the herb or when consuming high doses. This might not be what you're looking for if you need to stay alert during the day. Lastly, for this part, we're going to discuss the potential for allergic reactions. Like with any herb or supplement, there's always a risk that you could have an allergic reaction to ashwagandha. Symptoms can range from mild, such as a rash or itching, to severe, like difficulty breathing. If you've never taken ashwagandha before, it's wise to start with a small dose to see how your body reacts. It's crucial to remember that everyone's body is different, and what works for one person may not work for another. Always consult with a healthcare professional before starting any new supplement regimen, including ashwagandha. Now that we've covered these side effects, let's move on to the others. Continuing from where we left off, the next side effect is gastrointestinal distress. Ashwagandha, being a potent herb, can sometimes be a bit too strong for the stomach, leading to symptoms like diarrhea, nausea, or upset stomach. This usually happens when the body is not used to such concentrated herbal intake. If you're a first-time ashwagandha user, it's advisable to start with a lower dosage to let your body gradually acclimate to its effects. Next, we have the risk of allergic reactions. While rare, some individuals might be allergic to ashwagandha, experiencing symptoms such as rashes, itching, swelling, dizziness, and trouble breathing. If you notice any of these signs after taking ashwagandha, seek medical attention immediately. Then there's the issue of sleepiness and sedation. Ashwagandha is known for its calming effects, which can sometimes translate to excessive sleepiness, especially when taken in large doses or combined with other sedative medications. This is why it's often recommended to take ashwagandha at night or before bed to harness its sleep-inducing effects without negatively impacting your daytime productivity. Lastly, we have to talk about potential interactions with other medications. Ashwagandha can interact with drugs for diabetes, high blood pressure, and thyroid disorders. It can also interfere with sedatives and immune suppressants. Therefore, it's crucial to consult your healthcare provider before starting ashwagandha if you're on any medication. Remember, while ashwagandha has a slew of potential health benefits, it's not without its drawbacks. The key is to understand these side effects and manage them effectively. Starting with a lower dosage, taking it at the right time of day, and consulting with a healthcare provider can all help mitigate these effects. In conclusion, ashwagandha is a powerful herb with a range of potential benefits and side effects. It's essential to approach it with caution and make informed decisions about incorporating it into your health regimen. With all these side effects discussed, let's summarize what we've learned. Understanding the side effects of ashwagandha is crucial for any woman considering its use. Let's wrap up what we've learned about ashwagandha and its potential side effects for women. Ashwagandha, while a potent herb with a myriad of health benefits, can also present certain side effects. It's important to tread carefully and be aware of these potential pitfalls. Firstly, we delved into how ashwagandha can potentially interfere with thyroid function. It can overstimulate the thyroid, leading to hyperthyroidism. This may result in rapid weight loss, nervousness, and increased heart rate. We also highlighted the possible interactions ashwagandha can have with other medications. It can amplify the effects of sedative drugs, leading to excessive drowsiness. Additionally, it can interact with medications for diabetes and high blood pressure, altering their effectiveness. Then we explored how ashwagandha can affect pregnancy and breastfeeding. It's been suggested that high doses of this herb might lead to miscarriages, and there's not enough reliable information about its safety during breastfeeding. Lastly, we discussed the potential of ashwagandha to cause gastrointestinal issues such as upset stomach, diarrhea, and vomiting, especially when taken in large doses. While ashwagandha has its benefits, it's always essential to weigh those against the potential side effects. Always consult with a healthcare professional before starting any new supplement regimen. Always remember, knowledge is power, especially when it comes to your health.